The objectives for this course are as follows. First, to explain the physiological differences, risk factors, and treatment options for the various types of diabetes. Next, to identify the expected complications caused by diabetes and how they can be prevented, delayed, and treated when they do occur. Third, to outline the point-of-care procedure for obtaining a blood glucose level and identify normal versus critical values. Lastly, to develop a diet plan for the diabetic patient, along with teaching on when to check blood glucose levels. Diabetes can be understood by looking at glucose and insulin within the body. However, before discussing insulin, glucose, and the effects of their interactions, it is important to first understand the differences between anabolic and catabolic metabolism. Anabolic metabolism, or anabolism, represents a set of metabolic pathways that builds up molecules, requiring energy. Insulin is the most potent anabolic hormone known. It has multiple synthetic and growth-promoting effects throughout the body. Conversely, catabolic metabolism, or catabolism, represents a set of metabolic pathways which break down molecules in order to release energy. Hormones which are counter-regulatory to insulin, such as glucagon and epinephrine, promote catabolic pathways to release stored energy in times of physiologic need. We will now briefly explain the physiology of the glucose-insulin interaction seen in the healthy, non-diseased state. Insulin is normally produced by the beta cells of the pancreas. The pancreas releases insulin in response to ingested glucose and protein. Glucose is the most important stimulus for both insulin synthesis and insulin secretion. When glucose is ingested, it is taken up by the pancreatic beta cells via an independent glucose transporter. This means that the transporter does not need the assistance of another molecule, like insulin, to transport glucose into the cell.